Going live. Hey, everyone. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. I'm Mike the Voice Monkey. It's been a long week. I'm here, as always, with Dr. Max. Dr. Max, we've been off for a couple of weeks, or at least 1 week. How are things been going the last couple of weeks for you up there?
Going well. It too has been a long week. It's been raining pretty much all day, but a good day in the clinic. A bunch of patients needed to be seen, and overall can't complain. Got to go to a friend's wedding for the first time really since COVID, and everyone was wearing masks, of course, but it was nice to be outdoors and be at a live event. So that was an exciting part of my last week and a half or so.
That's very cool. All right. So We've been off for a week. Give me your top 3 cases over the last 2 weeks.
Well, I'll tell you some crazy situations that happened. I think it was 3 days ago. I saw in one day, the day started off with 2 cats that had lily toxicosis. One had eaten the plant, like the leaves and stem of the plant. The other had eaten some petals. Both symptomatic and starting to vomit. And it was just we see it from time to time, but one right after the other was kind of interesting, from a probability perspective. And then we ended the day with 4 dogs with bloody diarrhea.
Oh,
go figure.
The best.
The best. So that was fun. Today, there was a lot of inappropriate urination, some of whom, French bulldog with a UTI, most likely, and then a cat who I think has been freaking out and just really nervous because there's a contractor in the apartment and making noises, upsetting the status quo and the calm otherwise. So that's something. Some mammary tumors. I don't know if I have, the top 3 cases. Definitely I have the top 3 cutest patients.
Yeah. What are those?
There's a cute Brussels Griffin.
Okay.
The most beautiful Penelope girl. And then I had a little Chihuahua mix thing who was pretty overweight, but she was just adorable with her little belly. Molly. And I think number 3 was a pug puppy that I saw today. That was just stole my heart. But a couple of cardiac cases otherwise. It's really been a nice collection of everything this week. Seizures. Good. We've had, all of the previous topics that we've had: constipation, diarrhea, seizures. We've done quite a few at this point.
We have skin issues and allergies and ear infections and
ear infection. Yep.
Constipation.
No ringworm this week, or no presumptive ringworm, but this was my wife does a little drawing for each week when I come and sit down. This is her geriatric dog. Let's see.
There he is. Oh, he's got a cane.
Dog walking with a cane.
Yeah.
Yep.
And he's having a seizure.
Diarrhea. There's a dog having a seizure. That's that. But it's been a nice spectrum this week.
That's the best.
Yeah.
That's the best. I wanted to let people know who are watching, if you guys want to ask questions. We had quite a few questions last week. It was awesome.
We did.
Put them on, if you're on the Facebook, put them in the little chat there. It should pop up on my screen and we'll answer the questions. The Brussels Griffin is a very cute dog. Or as the snotty people say, the Brussels Griffon, because it's whatever. It's like people that have the cane Corso. It's a Cane Corso. It's like, okay, it's still going to eat your face.
I didn't know that. I actually didn't. I've never heard that pronunciation.
Yeah, we've had breeders that are like, it's a Cane Corso. Like, it's still going to eat me. I don't care what it's called.
Right.
It's still a scary dog. So,
sure.
This week we are delving into the world of geriatrics. Everybody has a dog eventually. Well, maybe it's going to get older and it's going to have problems. Hopefully all of us will eventually get old, unless your dog gets hit by a bus or, swept away by
God
a hawk
forbid.
or something. Yeah, but
Oh, God forbid.
something. I had a surgeon I used to work with that he told this story that his friend, so it was like a friend of was in, I think, Alaska or somewhere. They were RVing, and his wife had a little poodle that they would bring with him, and he didn't like this all very much. So he said he watched this couple over in their RV with their poodle, and she was walking the poodle, and all of a sudden an eagle comes down and just poof, off with the poodle. Poodle's gone.
Oh,
And of course the wife is freaking out. And the husband, he said he watched the husband turn around and go, yes. Where he's just he was happy to see the little poodle go. So
no. And that was the last
brutal.
of the poodle.
Yeah, it was the last they saw of the poodle. Poodle was gone.
That's really awesome.
Which is bad for the poodle. But yeah, the poodle can't help it. It's a poodle. But yeah.
Oh
so that
my God.
So if that didn't happen to your dog, then your dog is going to get older, or maybe you adopt an older dog. I'm into that. I like adopting these poor geriatric dogs that are in the rescue that like, they, the 12-year-old dog that needs a home, and why not give it some love for a year before it passes away. So so we're going to talk about senior or geriatric dogs tonight. When is a dog considered a senior dog?
I don't know if there's like one proper definition for that, but I would say, I tell owners around like 7 years old. That's kind of like when we start recommending on like annual blood work, maybe to start checking thyroid levels. Prior to that, unless a dog's showing symptoms, or there's exam findings that are suggestive of maybe hypothyroidism, you're starting to see some hair loss, pot belly appearance, you're hearing a history from the owner that might present that. You may do it earlier, but I would say it really depends too on kind of the size of the dog. Large breed dog, giant breed dogs, they make it to 6, 7. That's a long life.
Right.
But if you're talking about a little Shih Tzu, mini poodle, you can get up to 16, 17, 18. I had a friend's dog who lived 20 years, and per the family, they didn't do so much. They never did heartworm prevention. They fed it like Hebrew National hot dogs and all the good stuff, or bad stuff.
Well, that's like the old lady who's like, "What's your secret to living to 110?" She's like, "I smoke cigars every day and I drink whiskey." And so it's like, it's all genetics. So
yeah, for sure. I mean, there's a huge component. My wife's reading a book right now about the relative importance in one's life. I think it's human centric. I haven't read the book, but nature versus nurture, and this guy's making the argument that your genes pretty much dictate everything. So yeah, I mean, I would say small breed dog, once you get to 7, 8, 9, I would definitely say that that's a dog in his or her older years. And they have like charts that you can find online that the old adage growing up was like 1 dog year is like 7 human years.
Right.
I don't know if it's quite like that, but they have charts for like relative ages based on breed of dog or size.
Yeah, there's certainly, it's definitely breed specific. Yeah, I've definitely seen dogs that age before they get gray, and and if they've had an injury or something, or they've got some sort of issue, that can certainly accelerate the aging process. For
sure.
And if they're super fat, or they've got back issues, or they're hobbling around, these poor old dogs, you see, they come in, they're just and like the aforementioned pug and bulldogs, any of the brachycephalics, they just they don't age well at all. No. They just they tend to fall off a cliff at some point.
Yes. Persian cats as well. I know this is pretty much a dog only podcast, but I saw a couple Persian cats this week, and they're pretty much just like pugs and the Frenchies.
Mm-hmm. Yeah. Yeah, we can talk about cats. It's fine. You know, the Siamese cats live forever. They're like the longest. I've seen the oldest Siamese cats in their 20s that come in, and they just they got that noise they make. And
The Abyssinians too. They get up there and they're just vocalizing the entire time.
Yeah, I think they're just going, kill me. So so is there anything you need to do differently for your dog when it starts getting a little bit older? I know it's not a flip the switch, they're old kind of thing, but you know, it's got to be gradual. Like, what do people see that you maybe bring them into the vet, or have them give you a call and say, my dog's having an issue that could be related to old age? What do you see, or is there something?
I think there's all sorts of things. I mean, I think that there's, the class of like old age symptoms, slowing down, graying of the hair, maybe not wanting to go out for as long of a walk or as many walks, not as interested in playing, maybe not as interested in eating, eliminating in the household potentially when, prior to that, well house trained. I think those are some pretty common ones. And then, actual stuff that may have a medical origin, coughing, disorientation, agitation, restlessness at night, more cognitive neuro stuff. I think those are things that I see a lot as people come in. And then, of course, like orthopedic issues that could be leading to a dog not wanting to go out more and maybe putting on some weight. And I think there's like statistics, I don't know them off the top of my head, but a very high percentage of dogs above the age of 3, I think like 85% I read somewhere, have dental disease. And pretty close underneath that, I would imagine, are dogs who are obese, because they're not getting enough walking, or maybe they're arthritic, their joints aren't working as well, and they, as such, will not be going for getting as much exercise, and then just kind of become couch potatoes. So I think those are some of the big ones that I see when dogs age. And of course, like cancer, they're noticing growths, either subcutaneous growths that originate somewhere on the body, like they may even be benign or presumptively benign, like a lipoma. You can feel it feels benign. You can't really know without sampling it, doing a biopsy, but depending on the location, it can really interfere with quality of life. So I think a lot of the stuff, especially getting on to real end of life care, is assessing quality of life. And even if we're not going to be doing things to cure a patient's ailment or particular malady, just making it, their end of life as comfortable as possible.
Certainly. Are there things you recommend after a certain age, treatment wise, yearly blood work, any x-rays, scans, anything like I hear a lot of ads that this talk radio show station I listen to here in Atlanta has, every ad break is either a divorce attorney or some sort of ED doctor, and now they're running this life scan, whatever it is, where you can, you come in and get your full body scan. It tests for heart disease and cancer and blah, blah, blah. It's this magic scan that I think it's just a CT that tests, for all this stuff. Are there things like that you recommend for older pets?
Yeah, I mean, I think each clinic does it differently in terms of their offerings for, wellness, senior exams and stuff. And I think some very popular ones that I recommend for dogs who, say a dog who's 10, 11, 12 years old, who may have some underlying condition that's been caught previously or otherwise, starting to think about semi-annual exams instead of coming in once a year for an otherwise healthy younger dog, coming in twice a year, more likely to catch stuff before, at the onset. and I think of, common practice for like wellness things that, may catch stuff would be like a standard complete blood count, chemistry profile, thyroid hormone level, urinalysis, fecal, especially if a dog, tends to eat stuff off the ground that he shouldn't, or has chronic GI issues that haven't been resolved with, diet changes or, certain medications. But those would be, kind of a standard workup, maybe once a year, or, twice a year, depending on if the dog has something that's been established. And then, depending on what we are looking for, have indication of issues, x-rays, and, x-rays can be of the joints, of the extremities, thorax, abdomen. So I wouldn't just recommend, do a full body scan of every single cavity or bone or anything, because that would get very expensive and unnecessary. So it's really like kind of a targeted approach per individual. But I think, it's very individualistic. There are certain patients, like the urinary issues in the dog that I saw this morning. One of them had blood work done in January, and everything was good. And the urinalysis was normal. And we put him on, supposedly this dog had a UTI the year, before I got to the hospital, like a year and some change ago, and the owner said that he did well on this antibiotic. And he was having trouble, he was straining to urinate. That's when I saw him about a month ago. And so I guess we did blood work, a month ago, and everything was normal. Everything was normal in the urinalysis, and the antibiotics, even though we didn't really show any bacteria in the urine, I was like, do no harm. It may have a beneficial effect, and it did. And the dog responded. But now the owner's saying, it was fine. And then all of a sudden, he's been just urinating more frequently, but not straining to go, but voiding smaller amounts multiple times on a walk, not going inside the house or anything, just on her walk, she's noticed that. And so, I thought about the way that I want to go about treating or diagnosing, like, what am I going to try to work up? What am I more suspicious of? And I think because we didn't have any imaging done, I recommended abdominal x-ray to rule out some obstructive cause that may be causing him bouts going in smaller bout spurts, especially if he had previously been straining, even though maybe she's not noticing it now. So that was the one diagnostic that I chose today. The next dog in the morning, it comes in 2s or 4s, the cats, the lilies, or the dog's diarrhea. This morning was the 2 dogs with the urinary issues. And this dog who came in after, the owner had mentioned that he was urinating way more frequently, sometimes in the house, and drinking more frequently. And he had some blood work that was done in January. That was when it was done in January. And there were some liver enzyme abnormalities. ALP was high. And I also noticed his belly was a little bit more distended than I would want or expect. So I'm thinking maybe this dog is Cushing. So I could have done an x-ray on him, but I decided the diagnostic I think is going to be more fruitful will be a low-dose dexamethasone suppression test to rule out Cushing. So that's the one that I chose for him. Because at the end of the day, like, theoretically, like, possible that both of those tests come back negative. It would be fortunate for the dog, I guess, but unfortunate in terms of our diagnostic workup. Yes, we're able to rule something out, but it's really just about, trying to prioritize based on the individual, what's going on. And sometimes, we make the right call. And I guess the dexamethasone test is pending and probably have those results tomorrow, or maybe I'll see him come back from the weekend. But I didn't see anything on the x-ray. So I didn't really have much to tell the initial owner for the first dog. So it's kind of a little bit at a loss in terms of the most common reasons for a dog who might have pollakiuria. But yeah, it's really just, knowing the patient, understanding the clinical history, knowing what the owners comfortable with, knowing what the dog's lifestyle is. Certain dogs, need to be on glucosamine chondroitin. They're high energy, high use. They're going on long runs and hikes with their owners. I'm definitely going to recommend glucosamine chondroitin supplementation, maybe even before they become geriatric and officially like older dogs. But those who are like, indoors, good body condition, well maintained, and don't really run around as much, I would be a little less keen on needing to push for that, for example.
So, yeah, because a lot of times owners, we rely on the owners to watch their pets and kind of see their changes in behavior. Because you're right, you may see them once a year, twice a year, every 2 years. And a lot of times with these dogs, if they develop a tumor or some sort of condition, they don't start showing symptoms until it's too late at some point. They're pretty stoic, and they're, if you notice, well, he's just not eating, or I'm not saying with every little thing run to the vet, but at the same time, it could be worth a phone call. You never know. And if we've had many dogs come in with, well, he's had this tumor, or now, he's, and then we take x-rays and it's everywhere. And it's like, well, it's too late now. So you have to take care of that. So with old dogs, I know you're big on diet, good diets for these guys. Do you need to change their food once they start getting older? What do you recommend? And also, ask questions if they want to ask questions. Just put it in the Facebook chat, or go to rockwellpetspro.com, the page for Ask Our Vet. You can register there and ask questions. So, sorry, go ahead.
No worries. Yeah, ask away. It could be about anything.
Anything you want.
Yep. As far as diets go, I often tell owners that I want their dog, first and foremost, a food that they'll eat, because, oftentimes I'm going to be recommending dogs who have kidney disease or liver disease, specific therapeutic diet, by Royal Canin or Hills or Purina, depending on like owner, brand recognition. Some say, oh, I don't like Purina at all. And like, I'm not going to put, I think that different clinicians have different styles in terms of pushing owners in a different direction. And if I know, for example, that, a specific diet would be beneficial for their dog, but they hear something from their friend, that, oh, no, this specific brand, caused diarrhea in my dog. Well, I say that might not be the case in your dog. It could be worthwhile to try a can or so, see if your dog likes it. But obviously, I think it's one of the topics where owners are, it's one of the things that they can pseudo control in their dog's life, and you really can't. You don't want to interfere with that process, because to see your dog eat and enjoy him or herself going to the bowl and finishing it clean gives you a lot of joy, because it's giving them joy. And so, like, while I know KD or renal support E are going to be good for kidney diet, and I'll recommend those, they can approve or not. Excuse me. But oftentimes what I hear is, and I always recommend kind of a gradual diet change, not immediately cut it cold turkey. But even so, some owners after a week or so will be like, he's not eating it. He doesn't want to eat it. Like, can I go back to old food? And so, like, I talk to them about the pros and cons. But at the end of the day, like, I want the dog to be eating. That's the biggest priority for me. Nutrition, for sure. You need to be getting something. And we can discuss what that old diet is, and if it's, the best, if it's acceptable or not. I recommend avoiding raw diets, and grain-free, generally speaking. Obviously if there's a history of food allergy, I avoid, the specific proteins. But so there really isn't like a a game plan. Well, oh, your dog is turning 12 right now. We need absolutely to transition him to like the senior diet. Like, it's not necessary per se to do that, but we should be cognizant of his or her needs as they may change from a medical perspective. Obviously, if there is on routine blood work or not routine, if the dog has diabetes, and we know that for a fact, we're going to be strongly recommending, a low carbohydrate, high fiber diet. If the dog has inflammatory bowel disease or protein losing enteropathy or something, we want to get on a like high fiber, specific protein, hydrolyzed protein diet maybe. If a dog has cardiac disease, look for low sodium. Dental disease is one of those tricky areas, I feel, because I often hear different things. I think you asked a vet, two vets will get three opinions.
Sure.
For me, I find that hard kibble is better for dogs with dental disease. It's more abrasive, kind of helping get food particles that may be stuck on the enamel off. But obviously, if a dog is in pain from dental disease or a tooth that maybe needs to be extracted and the owner doesn't have the funds to do so, or isn't really able to for whatever reason, maybe wet food is better because it's a little easier for them to actually prehend and chew and swallow. So there's that to think about, the actual consistency of the food.
Do you remember TD? Do you remember when they came out with that?
Yeah, of course, yeah.
Do they make that anymore? Do they still make that?
I think I'm pretty sure they do.
The tooth diet or whatever with the.
Yeah.
I remember. I remember we would have these reps come in and they would buy us lunch, and we would sit there for our lunch break and they would talk about insert name of product. And when they brought TD, they had like a screwdriver or something, and they would poke. The kibble was massive.
It's big, yeah. That's one of the hard things.
Yeah, they would poke it with it and say, "See how it's squeegeeing off the tartar." It wouldn't bust immediately. It would kind of give a little bit, and then it would. But I knew people that would feed TD, like just feed it. These massive kibbles of TD.
Imagine a chihuahua trying to.
I know. But it was just, I think they had like a small version too. I think it was like for smaller dogs. But it was like capital T or little t. But it was then they said, well, no, give it as a treat. Just kind of give your dog a couple of kibbles of that after he eats to squeegee off his teeth. And maybe we'll have a show on dental health. That would be something I could, because I've done, I don't know how many dentals I've done in my life. I've done so many. I've pulled so many teeth. Dental X-rays, and you just see nothing. And I used to call like little dogs to have wind chimes, because all their incisors would just be kind of moving with the breeze. And you just go in there and go, and just all fall out. The only thing's holding them in is tartar. But definitely at that case, they would need a soft food if you don't have any teeth. If a dog is healthy, would you recommend changing to a senior diet when they got older? Is it a necessary thing to feed when you go to the store and it says IAMS Senior Health or Purina Senior Health or Eukanuba or wherever senior, active senior? My dog's ancient. It's like she's like 12, 13. We feed her like active maturity from IAMS, but
yeah, I mean, it's definitely not necessary. What's necessary is, being cognizant of I think, I always tell owners, even like puppy, first time puppy owners, like, I'm, really glad to, be the first vet who has the honor of meeting their dog. Like it's really, they're probably going to meet a bunch over the course of their life, or maybe I may be the only one, so it's important that, that first visit, we lay down what's important for their dog, and from a preventative health standpoint. And what I tell people from the beginning is, you're gonna like, it's such a joy, like, to, be feeding your dog, see them eat. I start seeing puppies being overweight, as early as a couple months old, and I I would say it's rare that I see it that early, but I would say for the most part, those young dogs, such high energy, and they know how to regulate, and owners maybe follow the feeding guidelines and adequate exercise. But if they're not getting that exercise and eating too much, I will talk to owners about, like, your dog's gaining weight, he or she should be at this time, but we need to kind of pump the brakes on the rate of growth, because it's a little bit wider than taller.
Yeah, exactly.
And so, like, I think while those senior maturity diets, senior wellness stuff has its place, I think the biggest things, like feeding that to a dog who is obese, is not as important as having the discussion with the vet as to what's the proper, like, calories for my dog for his, like, daily energy requirements. How much does he actually need? And if you're feeding that senior diet, but like 3 times the amount you should be, then that's not appropriate.
Yeah, people are shocked at how much when you calculate the kilocalories that the dog is supposed to have, and then you equate that to how much cup wise that is for the food. People are astounded. They're just like, oh, I just fill out the bowl, or he gets a cup. You're like, a cup? Or like, a cup? They hold up like a big gulp from 7-Up or 7-Eleven or whatever.
Yeah.
And you could put 7-Up in it, I guess. But they free feed. They just have
free feeding. Yeah, I try to highly avoid that.
I know. I always tell people, like, do you free feed as a human? Do you just walk around and you just eat whenever? Because guess what? You're going to get fat, and that's the same thing that happens to your dog.
I saw a thing that I think Dr. Wen is her name. She's some human physician that goes on CNN from time to time, and there was like not Dunkin' Donuts. Krispy Kreme is doing a promotion for vaccinated people. COVID vaccinated people till the end of the year, I think. If you present your vaccine, you could get a free donut once a day or something. And
something like that.
She said that if you actually took advantage of that and did have one donut one donut a day, or maybe one donut a week, I think, for the whole year, and didn't really implement any other change in your life, you would gain 15 pounds that year.
Yeah. And they say COVID affects obese people worse than any other group of, not worse, but it really affects obese people. And here Krispy Kreme is like, oh, you got a vaccine? Have some donuts.
Pretty much. So yeah, I mean, there's like the importance of treats, but also I was telling her, check the label and see how much kilocalories per unit that you're feeding, and we don't want that to be more than 10% of the daily diet, and it can really add up quick. And from a psychological perspective, I'm sure the dogs love it, but it's not necessarily in his or her best interest to always get it.
That's right. Food does not equal love. So and also tell everybody watching, if you guys want to ask questions, it doesn't have to be about old dogs or fat dogs or bad teeth dogs. It could be just about anything pet related. Certainly send it on in, and we'll happy to answer questions here. Are there any kind of additives or anything people could add to food to help with their aging pets, to help them out? You mentioned glucosamine earlier, but is there anything else?
Yeah, I mean, I think that's really good. I think, for various skin conditions or, itchiness, coat quality, omega-3 fatty acids are good. That can also be really good for like cognitive dysfunction syndrome, or like, doggy dementia. So I think that can be a really good thing, depending on the dog's GI tract, and if there's issues that are kind of becoming chronic. depending on, test results, potentially supplementing with like vitamin B12, cobalamin, could be something to do. So those are supplements I think about. And then also, circling back to the dementia side of things, melatonin can be really good to kind of regulate the sleep cycle. And it also can be an adjunct for dogs who have various syndromes, alopecia. It may take a while to kind of kick in, but it can kind of help with hair growth.
Okay. What about like Cosequin or Dasequin, something like that? A nice joint supplement?
Absolutely, yeah. So, glucosamine, chondroitin, and those types of things are, once I think you start off for a couple of weeks, twice a day, and then you level off once a day, kind of indefinitely, for sure.
Are there things that you can do with your pet being younger to kind of help them ensure they have an easier old age? Obviously, keeping them in shape is definitely a good way to go. But I know we said a lot of this is genetics, but is there anything you can do during your dog's life besides taking them to the vet that can help them out in old age, make them more comfortable, I guess?
Yeah, I mean, I think it's, being as compassionate and patient with them, and knowing that, I guess, depends on what life stage you're in and your, abilities or lack thereof. I know that there's quite a few dogs who are supportive of their aging owners. And then there's, really young people who have really old dogs, and it's kind of the reverse. So, I mean, it really depends. But I think one of the best things is just to be present and like understand, or as best as you can, like what the dog's wanting. I feel that there is such a jump in recent years for owners to jump to medicating their dogs for behavioral stuff, anxiety, separation anxiety, noise phobia, with those fireworks or loud noises, whatever.
Right.
And like, it has its place, their aggressiveness. There are drugs that we can definitely give that may or may not have an effect. I think it's really just from an early, I think your question was more like, what can you do starting kind of earlier on to make sure that the transition is smooth?
Yeah, kind of lifestyle choices. Don't let them smoke, don't let them drink,
No alcohol, no
That's
alcohol,
right.
no onions, no grapes, no raisins, no lilies.
No gum.
No sugar-free gum.
On it. Yeah, exactly.
Yeah, exactly. For sure.
No chocolate.
Definitely not. Although I know people who have fed their dog chocolate for years, and nothing. There is a spectrum. Like white chocolate is probably like the best, and then if you go to milk, then to dark, then to Baker's is the worst. I don't even know what Baker's chocolate is, but we learned that was like the highest.
We had a neighbor of mine give my kids these giant Easter bunnies, chocolate Easter bunnies for Easter, and they were like a strawberry and cream chocolate or something. The bunnies were pink, and they smelled really strong of strawberry. And I tried a little bit of it, and it was just chemical. It's just tasting. And
like
one was on my wife's desk, and it turns out that my ancient dog is just tall enough to reach the desk. Got it down, ripped it open, didn't eat it, but licked it and right across the middle, and just licked it until it made a little crater and a little hole all the way through it. She must have just sat there and just licked it. And it was one of those things like, she's, coming up on 100 pounds. So a little bit of chocolate's not going to be that bad for her. It's happened. She's eaten like a Nutella container, but she just, just laid on the floor, just licked it. She must have had nothing to do. And of course I'm looking at our little dog. Like, I figured the big dog would just eat it. But the licks were too big for, the little dog's tongue. And I figured, well, if the little dog's going to die, it's going to die, but it's fine. Just keep an eye on it. And, but yeah, it was the weirdest thing, just licking that chocolate. And
Wow.
she must like the chemical taste, because it was like, oh,
Yeah.
you pick it up and look through the hole and then throw it away.
That's funny. I don't think my dog ever got into. I don't recall her ever getting, my first dog, Phoebe, Westie, didn't ever get into chocolate to my knowledge, but I do vividly remember, this is a little bit of a tangent, but definitely, I guess on the topic of keeping your dog healthy into the, later years, just trying to avoid things that dogs shouldn't eat. And so my mom had a mahjong tournament, if you're familiar with that game.
Yeah.
It's like the Chinese, yeah.
Little tile game.
The tile game, yeah. And there were 2 extra pieces like that she had kept in a saran wrap. I think if you lost a piece, these were the 2 extra pieces, and she put them on the side because they didn't need them for the game. And I was like there, she had all of her friends over one night, and they couldn't find the extra tile pieces, like when they were putting up the game or something, and they're supposed to go in a specific location in the board box or whatever. And so she was like, "Oh my God, Phoebe ate them. Phoebe ate them." There's no, like, she had to. They can't be anywhere else. And so, like, we gave her hydrogen peroxide. Like a few minutes later, she just puked up everything. We gave her more. Again, nothing. And then there was like nothing, just some bile and foam and some food, no tiles. And then we were like so worried, like, what if they're deeper in her? And then a few minutes later, one of the guests found the tiles, of course. So all that
Poor
for
dog.
nothing.
Yeah, we've had dogs way in the past that have come in for chocolate toxicity, and we've given them the epimorphine, and they just puke. Just
projectile,
yeah, and it looks terrible, but it smells like chocolate. So you're like, yeah, it looks bad. It looks bad, but it doesn't smell too bad. But yeah, no, it's bad times. So, let's talk a little bit about when your dog gets older. We'll get to the cognitive stuff in a minute, but in terms of arthritis with your dog when it's older, I mean, we've got dogs, especially if they're bigger dogs, or maybe they've had some knee problems, hip problems in the past. What do you recommend with our geriatric pets in terms of hardwood floors or stairs or walks or medications they could take, NSAIDs or something that they could get on? What do you recommend for those?
Yeah, I mean, I think all that you said is spot on. A dog who has a history of, cruciate ligament tear or something that may have been surgically corrected or not, or, addressed with NSAIDs. If the dog it's a hardwood floor and they have to go upstairs and everything, and you're feeding and, giving the dog daily medication, it can be helpful to a degree, but it's also like, you really need to cater the environment to them. I guess, try to think about it like older people taking a shower, install the bar,
right,
shower and stuff. You really need to make their lifestyle a little bit easier. And I think the hardwood floors can be really difficult sometimes. So, recommend carpeting, the pick-me-up harnesses for really like giant dogs who may be overweight and really have trouble on the back legs, which is doing a lot of the weight bearing. I think like 60% of the body, the back half, versus 40%. Like a pick-me-up harness is a really good thing for those dogs. And, joint supplementation, plus or minus, NSAIDs. And, NSAIDs, we have to be careful with those long-term, gastric ulcer possibility. You may need to coat the stomach with something and or try like maybe like Galliprant, which is a little bit easier and, maybe less likely to cause kidney value elevations than like Rimadyl or something.
The little harness you were talking about, is that the one that goes around the chest, or is that the one that goes around the rear end that you kind of support their butt with?
Oh, so there are those too that have the wheels, if that's what you're talking about. The
Well,
premium
no, there's one
harnesses.
it looks like a sack with a big long handle on it, and you could put it around their hips. Kind of it's just like a little
Yeah,
diaper almost.
I
And
was thinking of that one. Yeah.
there's one we used to sell we had a rehab facility in our building, dog rehab, which is also great for old pets. Take
Oh yeah. Yeah.
if there's an animal rehab place that you have access to, underwater treadmill, swimming, things like
Yeah.
that
Yeah.
are all fantastic. And we would sell this harness that would go around their chest, and it would kind of buckle and snap, and they would just wear it all the time because it just
Hmm.
fits on there. And it had a handle on the back, and it was like quadruple stitched. Like, this thing's never gonna rip or tear or anything like that. And we would use those because it's a little more center of gravity when you're picking your pet up. You're not just trying to pick their butt up and their front end's going every which way. You could hook leashes to it. And we had a dog come in one time that he was missing a front leg and had dropped carpus on his other one, on his remaining front leg, and had to have surgery on it. And this was a huge dog, and it wasn't very nice. And we put the harness on him, and we were able to kind of help him around. He would boom, 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 bang around on that one leg with the harness. And there was one time I went outside to get him, and he didn't like me, and he rolled over on his back and tried to bite me. And I just reached under him, grabbed the handle, and just went whoop, and then all of a sudden he was upright and standing there and didn't know what happened. But I had to come up with a name. I can't remember the name of those little vests we used to sell. Those things were amazing. But yeah, to help our poor little arthritic dogs. I definitely like carpet runners. People talk about those, but make sure they have a little grippy on the back. We don't want to put down something the dog's just going to slip out from under him. I've gotten a few of those rugs from Lowe's and Home Depot that have the rubber on the back.
Oh yeah, I know what you're talking about. Sure.
Yeah, my poor dog. We put it at the bottom of the stairs. My poor dog would just splat on the hardwoods if we didn't have something there that if it didn't slide, her front feet would just hit the floor and she would just. So now we have the rug and she does fine. Fine with that. Talk a little bit about we have some questions here about the cloudiness in the eyes, cataracts, things like that. What do we see in older dogs, and what can we do about it?
I guess thinking about eyes, for sure. I think about cataracts. I think about glaucoma, and I think about the importance of the physical exam, the vet noticing those on an ocular exam. And if there is any, usually it's, you first see that bluish haze or tinge. And, if there's some immature cataracts seen, discussion about what could that be. Also, there's, a big correlation between cataracts and diabetes. So I think collecting like a minimum database, getting the blood work, seeing if there's an underlying cause for that, understanding that if it's in one eye but not the other, especially if the blood sugar is really high, and we might want to start thinking about diagnosing and treating for diabetes, being cognizant that also it may occur in the other eye, and we're just trying to delay the onset of that. But of course, for dogs who are completely blind or have enlarged globes and painful, really high pressures in their eyes, they may not even be visual in that eye. So potentially thinking about topical medications to kind of help with the outflow of the aqueous humor in the eye to reduce that pressure. Or if it's really like end stage, maybe even enucleation and removing the eye, because if the eye is just, it's gone and there's no real purpose in terms of vision that it serves, it's really about quality of life at this point. And so removal of the eye is sometimes one of the best things we can do. And dogs are just so much happier and feel better, and owners may look a little strange at first, but owners are like, wow, he's just doing so much better. It's like the tiniest little thing. Obviously eyes are very important, but very, in terms of the grand scale of the body, eyes doesn't take up so much real estate, much like a cuticle, but that one little cuticle can make your day horrible. if it's not in the right shape. And so like when it comes to dogs who have, decreased vision, they're really not walking around or bumping into things around the house. You're talking about the non-slit stick carpets, or like the no runner carpets or something. Simple lifestyle changes for the eyes. I've seen this thing and I've recommended it to a couple of pets. It's like a halo around the head. I think of them like angels, and it's just like a little thing that helps like increase their proprioception. I guess they feel a little, that thing is going to bump into the couch before their head does.
Gotcha.
It's going to prevent them from traumatizing their head, and those things can be actually really good.
That's what those things. That's what they do with e-collars anyway. They just run into stuff before.
Exactly. Although, e-collars are, e-collars are just the best and the worst.
I actually just texted my the physical therapist I know and asked her about that harness, and it's called Roughwear.
Okay.
RUFF Roughwear harness. So glad she was by her phone. But yes.
Yeah. Quick response time.
Yeah, I know. I was very happy about that. Normally, normally I just text her and go, "Can I bring my dog in for free?" And But so in terms of cognitive issues, we have grandma, grandpa gets older. They start, there's, is there an Alzheimer's with dogs? Is there sundowner's dementia or anything like that with dogs?
I actually had to look up that term. I wasn't familiar with sundowner's dementia, but that is I think it kind of falls into that cognitive dysfunction syndrome umbrella term, in terms of dogs becoming more needy, attention seeking, maybe disoriented, maybe restless at night, kind of the sleep wake cycles altered, maybe vocalizing at night. Definitely described in the literature and anecdotally from so many pet owners. 2 cats came in with those issues this week, both of whom were like 16 and 17, so typical. But yeah, it's definitely a noted thing. And there are, melatonin, fish oil, omega-3 fatty acid supplementation. Selegiline is a medication that can be used, help with dopamine levels in the brain, and kind of make dogs a little bit happier and maybe more relaxed. So that's kind of what I think about for dogs who are showing the sundowners and dementia later on in life. It's difficult because there's no real way to reverse that or fix it or anything, but
right.
Some of those therapies can be pretty efficacious. They may not work, but I think it's definitely worth a shot to try it. And really just, at the end of the day, coming to terms with the fact that this is happening in your dog's life, but there really isn't a way to fix it. But understanding how, their needs have changed, and, if, you may need to make changes in your environment that might not be optimal for you. But, if you can get around it, try it. So some of the things that I've heard about are leaving lights on or putting music on. Definitely whenever we leave the house, back home, my mom would put on music for our dog, the radio playing, and so if there's any crazy noise outside, she won't hopefully get spooked. But I think putting music on, maybe even at nighttime, leaving lights on in the bedroom, maybe then you can put a mask on if your dog sleeps in your room, putting a mask on your eyes or something. Some dogs can respond better, and they don't get freaked out when the lights go off and their rods, the photoreceptors in their eyes that kind of are active in low light, maybe they're not as good as they used to be, or they're partially visual. So just making those changes and being aware that your dog is having this I think not being in denial, just like understanding that this is a change. We can try these things. It may not work, but little lifestyle changes that can be of use is a big thing.
So I want to let people know if they want to get $10 off natural dog vitamins, go to rockwellpetspro.com and use the code SENIOR, which is funny when people misspell it. They're like, oh, my dog is a senior. It's like, no, it's senior. I think the big thing in terms of your dog's older and it's having issues and it's a quality of life issue is that a lot of clients have a hard time being honest with themselves and being because they don't want to admit or they don't want to let go or they feel bad and that's, I'm sure it's hard for you. I know it's hard for us back then you can't say it's time, you just have to like, some of the language you use to work around that to be like, well, we're trying to keep them comfortable or we're trying to, you obviously can't recommend that, but it's hard on you guys.
When it's really end stage, and I think it's hard on us as veterinary professionals, it's probably a contributing cause to like the high suicide rates. And, we see death so often. It's hard, but I think at the end of the day, we took the oath to help, our animals be their advocate when the owners want to be their advocates, but obviously they have bias. And, we may be able to be that force in the exam room on perhaps the pet's last day. And we're often there. And sometimes we are there at the end when the owner is not even there because the owner can't handle it for themselves. And they, don't want to be there. Maybe part of them does, but they just can't figure it out. And, we always give the owners the option to be present or not when it comes to that. But, I think it is okay to say it's time. It's hard. It's never an easy thing. But based on the way that, your conversation goes, if the good days are far, far outweighed by the bad days and the dog's weight, 50-pound dog is now 32 pounds, which I've seen before.
Mm-hmm.
And, you've tried everything in the book, then, you have that ability. I don't try to shy away from it. I hate doing euthanasia. It's the least favorite thing in my job, but
it's good to hear.
But,
That's your favorite.
But, not my favorite.
I can't wait.
But like, we can say that, and we can at the very least, try to be that strong, presence in the room for the owners and the dogs. Anyway, it's tough.
It's never easy, and it's definitely the least greatest part of the job where you've got people you see people on their worst day, and it's never easy to let go of a pet. And a lot of times when they get to a certain point, it's time. It's you have to be honest with yourself and say, my dog, am I letting my dog go on for me or for him?
Yeah.
That's always a tough conversation. So, well, we're getting ready to wrap it up here. We're getting ready to I was going to say put this show to sleep, but that would be a bad choice. But hey, if you want $10 off natural dog vitamins, go to rockwellpetspro.com, code SENIOR. But yeah, we've made it just about an hour here for talking about good old dogs. We'll see what we do next week. Maybe it's dental disease. Maybe it's arthritis or cruciate. I'm holding out hope for that cruciate show. I really want to.
Yeah.
I've got a lot to talk about with that. So, but anyway, anything else any other little tags you want to add on for our senior pets?
Well, I think, I guess, you can teach an old dog new tricks. And, I think, by tricks, just, you may be surprised by like the amount of changes that you can institute in your dog's life earlier on to allow him or her to live much longer, and surprise you sometimes with new or weird things. Like my dog who started to stand on her on her forelimbs when she urinates. She didn't do that for the first 4 years that we had her. She's 8 now, but I think around 4, maybe even 5, she started doing that cool trick to urinate. So it can happen.
Dogs are weird.
Dogs are weird, but they're wonderful. And I hope that y'all took away some information from this show. Thanks for asking all those questions, Mike.
Absolutely. So we'll see you guys next week. We'll put online what our topic is next week, and you guys can ask questions. Other than that, I think we're done. Have a great night, Dr. Max.
You too. Take care, Mike.